Hello, my name is Maria Wellish, and I'm the Corporate Vice President at Morningside Ministries for Community and Corporate Education. And I also work with mmlearn.org, and that's who's providing this presentation for you today. We talk about survey readiness when we work in long-term care, and I want you to know that survey readiness should be everyday readiness is what we ought to be calling it. I'm a real realist. I want you to know I've been in the field for a long time, and I understand how hard an industry it is that we work in. So the program that I'm going to give you today, I hope is very real world and very meaningful. I know that when surveyors come in the house, we get very nervous. And I know that we get very uptight because it does have a great impact on us and on all of the staff. But I want you to know that what we should be doing is just basic common sense on most things that we just need to be looking at, making sure that we're taking care of it. So this is a very quick, I want to kind of walk you through your facility and help you look for things to make sure that you're not getting deficiencies for things that just don't make sense, that they're very simple but very important and meaningful things. So I'm going to start with just a brief walk with you. One of them I want to talk about is an infection control issue, and these are some of the things as a consultant and as I've worked in different facilities throughout my years of things that I always pick up on. And one is an ice chest that has the scoop inside the ice. Okay, we know immediately that's going to be an infection control deficiency. Any water that is in a pitcher on a med cart must be dated, must have the time that the water was put in it and the initials of the person that prepared the water. And this is just for a regular med pass, so make sure that that's being done. Sharps containers. These are infection control. These are OSHA hazards. When they hit the line for the number of needles, they need to be changed. So watch those sharps containers all the times. Do you know that you have only a certain number of inches from the roof where you can have boxes, and almost all of us put red tape up all the way around, but we don't always tell employees that we can't have things too close to the sprinkler heads. So we have a distance that has to be maintained, and if you're in a different state, I want you to check your own regulations on this. But I want you to be very careful that we never have things over the level of where you should mark off the piece of red tape for no items above this line. Refrigerators have to have a temp log on them if they have employee items in the fridge. And even for all refrigerators, let me take that back, have to have a temp log on them. Even employee refrigerators should have that for our own safety, but for sure for the residents, it must be checked every day and signed off with what was the temperature, not just a signature, but what was the temp. Want to think about any irrigating equipment, any saline in a room, anything like this has to be dated. Once it's opened, it has to be dated. I want you to think about if you have, some people call them crash carts, your emergency carts, AEDs now are required to be checked. We want you to have a log to do that. Make sure when you're walking through that log is just updated and done. Nev machines, when we have nebulizer machines at the bedside, we know that any equipment with that, if we have a mask, a cannula, anything that's there that deals with oxygen has to be kept in a bag, labeled with the person's name, the date that it was changed, especially maybe putting just a little piece of tape around it on the date that the tubing was changed and initialed and the time that that was done. We want to look at every closet. No closet can have anything stored directly on the floor. Boxes must be up off the floor, so we might have pallets or you might have plastic, little pallets that you use, but you can't have boxes directly on the floor. And people do that all the time. It's one of the most common things that I see. All personal items of a resident has to be labeled with their name, their room number preferably, and then again, just make sure that the toothbrush has the person's name on it. I walk through a room sometimes and I see a toothbrush laying on the sink and there's two people in the room. I don't know whose toothbrush that is. We want to make sure that all of our trash containers don't have anything overflowing and that every restroom that we have has plenty of paper towels, an adequate amount of soap. Easy to walk in and check that. You can't have items lined up on both sides of the hallway. We have to make sure that we have a good exit in the event of a fire, so we need to make sure that a linen cart if it's out, a bucket if it's out, the med cart, a machine for blood pressure, anything that you have should be on one side of the hallway. This is good information for a new employee who's just come to long-term care for the first time. If you have isolation precautions and you have the equipment outside the room with gowns, gloves, masks, all that, the room still must have a sign on the door that reflects that there are isolation precautions and to see the nurse at the front desk before entering the room. Shower chairs, wheelchairs, any items that residents are using have to be clean. Clean, clean. When I go through and I see mesh on a shower chair and there's mildew on it, I have to tell you that is an infection control. First of all, it's just plain ugly, but it's an infection control hazard. Wheelchairs cannot have food on them. They can't have strings in the wheels. Walkers are the same thing for people. They need to be cleaned, and I know this is hard to get done, but it's an infection control hazard and a safety hazard to have threads in the wheels. So let's talk about never seeing linens on the floor. This is a training issue for people. Linen can never be placed on the floor under any situation. If there's oxygen in a room, there has to be a sign that there is oxygen going on in that room, that there is oxygen, and to use caution for oxygen. Let's talk for a minute about oxygen tanks. Oxygen tanks all have to be stored separately if they're full or they're empty and have to be appropriately marked, and I hope this slide helps you a little bit with that. If it's a single cylinder, it must still be contained or chained to a wall. All of you have different ways of doing this, but you can't have a loose oxygen tank. That's like a torpedo. Another thing about oxygen tanks are that you need to make sure that these are not left out and about in a room. I recently was walking through a facility and saw in a restorative, a rehab area, an oxygen tank in there, but no sign that there was oxygen in the room. So it doesn't matter where the oxygen goes, the room has to have a signage that there is oxygen going on. Let's see what else I can share with you. Hydration carts. Oh my gosh. For some reason, people don't think hydration carts need to be cleaned daily. These really need to be scrubbed down because that is a major infection control hazard. Microwaves are the same thing. The interior of a microwave must be cleaned. Ice chests, you should have a routine for how is the ice being taken out, how is it being cleaned, and this is done on your individual facility protocol. Who would think about blood pressure cuffs as being infection control hazards, but they are. We know that we don't take a blood pressure cuff into an isolation room. But on the other hand, I see blood pressure cuffs that are attached to machines that are filled with lint and they're not clean. They need to be replaced. Those are very, most often we can wipe some down, but after they're all filled with lint, you don't have a good attachment. Infection control hazard. Call lights have to be with a resident at all times within their reach. And many people forget and don't know in long-term care, even if someone is in a comatose state, they still must have a call light within reach. They must have their water, unless they are on fluid restrictions, available to them. It needs to be fresh. Their water container should have their name on it, and we should know when it was changed out. People should be offered whether they want ice water, just fresh water, but it must be within reach of the resident at all times. And we're always talking about hydrating our residents, so we want you to make sure that we've done that. Oxygen concentrators require signage as well that there's oxygen in the room, and if you have an oxygen concentrator that has filters that have to be changed, the little spongy filters, you need to have a protocol in place for that. It's one of the first things surveyors look for because you are setting someone up for infection. This is an infection control hazard, and that's the tag that you're going to take that on. Supply room, again, even though it's a supply room, no boxes on the floor. Overhead tables should be clean. They should not have a million empty medication containers on top of them. If a resident has hand cream or other things on it, write their name with a Sharpie on top of it that's indelible so that we know who it belongs to. Again, I keep seeing notes here. Med carts must be clean. Do you know what they look for when they look at med carts? Loose pills in the bottom of the drawers. That says to me that's a problem in itself, and we're going to spend just a minute and talk about some pharmaceutical or medication administration issues very briefly. But just remember that med carts themselves must be cleaned down, and very clean. Bottles of hand sanitizer should not be left all over the facility. Those should be either hanging on the wall or in controlled areas. People with dementia may not know and could drink the hand sanitizer. So we want to make sure that those aren't just left around. Hipaa violations are another thing. We cannot leave assignment sheets out on the top of counters. We cannot leave computer screens up that people can read any information or learn anything about who's in our facility, what is their diagnosis, what are their needs. We don't need for somebody to be reading about somebody's BMs. Remember, this is confidentiality at its best, so walk around and see if you see any Hipaa violations. Take a walk yourself with your staff and see if you can identify things to improve on. See what else I want to just share with you. I would make sure, of course, that there are hair nets available when you walk into any kitchen area or food service area, and that people understand that all hair has to be underneath the hair net, not just partial, not sitting around on the top of their head to protect their hairdo. If you have a beard, you have to wear the same kind of coverage to cover up so that no hair is getting in the food. Water pitchers, as I said, need to be changed out, but the most important thing is that they are available to people, and then start looking, if you have community showers and even individual showers, that things should not be left in the showers. Personal items, all clothing, all linens, everything has to be removed each time somebody goes in a shower. So we're going to stop for just a second. I'm going to move over and talk for a second about some medication tips for you. And these are pharmacy-related survey citations that you can just avoid, and I want to run through them very quickly. So if you're a med aide, you're a nurse, these are some things to think about. You need to check medication carts, refrigerators, med room cabinets for expired insulin, TB, and house stock items. Those are the most often forgotten. We look at other things in the drawer, but remember to look at those. Make sure that all insulin vials are dated when they're open. Some insulin vials and other multi-dose vials generally expire in 28 days after opening. There are two that don't, that are good for 42 days, and if you want, I'll put up this program right as part of the paperclip so you can have all that. Verify that all the TB test vials are dated when opened, because the TB test vials are only viable for good for 30 days. So remember, 30 days for TB. Secure your house stock medications. Only licensed personnel may access them. And in refrigerators where vaccines are stored, the temperature should be documented twice a day. Let's talk for a second about FTAG 329. I hate getting into those numbered tags, but these are unnecessary drugs. You should be documenting non-drug interventions prior to administering PRN psychoactive meds. Non-drug interventions should be listed in a resident's care plan. These are great tips because they're the right thing to be doing for our residents. Labs have to be drawn as ordered, and the results have to be readily available. You have to have enough documentation to support the use of an antipsychotic medication in any dementia resident, and behaviors must be a danger to the resident or others. Care plans for psychoactive medications have to reflect the target behaviors or the PRN usage. So these are everything kind of rolling in together. And I know I'm going through this quickly. I'm always willing to answer questions. Info at mmlearn.org. Medication regimen review. I have to tell you that pharmacy recommendations, we all have pharmacy consultants coming in, they have to be turned around within 30 days as the expectation of a surveyor, and it's an expectation of why we're even doing this. So make sure when the pharmacy consultant comes in and gives you recommendations, we get these out and we get the doctors to return what they want to do within 30 days. And they should be acted on immediately in some cases by us. So we need to look at that. So let's finish up with FTAG 333, medication errors on a med pass. Make sure, again, there are no loose pills at the bottom of the medication cart drawers. Be sure to follow the manufacturer recommendations when administering your proton pump inhibitors. These should be many times administered before eating. We have other recommendations of medications that should be given 2 hours before meals, 1 hour before meals, at bedtime, and yet we see some of these things being given to people in the morning and wonder why they're so anxious or why they're so sleepy during the day. You have to follow those. PRN controlled substances have to be signed out on both the MAR and a proof of use sheet. So make sure even the PRN meds. And nurses should be able to explain to anybody our controlled substance reconciliation process. So there are so many things to learn in the long-term care industry. So many issues that continue to come up over and over for us. So all I can say to you is we're going to continue to bring you everyday readiness and survey readiness to just prompt us to think differently. If you're a new employer, you've been doing it for years, to remind you these are important considerations. I thank you for spending these few minutes with me, and I hope this helps.